Both of these people were scheduled to travel for work.
We leave the Washington Journal and go back to the floor of the U.S. Senate. Live coverage on C-SPAN 2.
With time equally divided and controlled between the two leaders or their designees, and with senators permitted to speak therein for up to 10 minutes each, and the majority leader recognized at 5 p.m.
Without objection.
Suggests the absence of a quorum and asks that the time that is consumed under quorum be divided equally between Democrats and Republicans.
Without objection, the clerk will call the roll.
All subsequent quorum calls be equally divided between the two parties.
Without objection, the clerk will call the roll.
Mr. Alexander.
Madam President.
The senator from Maryland.
Madam President, I ask that the call of the quorum be vacated.
Without objection.
Madam President, I rise to continue the discussion I've had on the situation in which we face ourselves, which is that the entire government of the United States of America has been shut down, or that those federal employees that are working without pay. This is a terrible, terrible situation. I implore the House to pass a clean, short-term, continuing funding resolution that the Senate sent over to them 4 days ago so that we could reopen the government. Let's reopen the government. Let's reopen the government of the United States of America. The way that you reopen the government is pass the Senate continuing funding resolution. What would it do? It would fund the government at fiscal 2013 levels. That doesn't mean that it adds new money, okay? So there's no new money. It's keeping that which we, at current spending levels, we would have a continuing resolution to November 15th, short term, while we work out other issues, and that we get over the issue, the speed bump of raising the debt ceiling. I believe that is what is the path forward. Where we are now has terrible consequences. It has terrible consequences for our economy. It has terrible consequences for our standing in the world, and it has terrible consequences for the functioning of our government. We talk now about a shutdown of the government. Right now, there are hundreds of thousands of men and women who work for the federal government who signed up to do a job in the service of their nation. They are literally, as the passing hours have either had to take a furlough, and a furlough is a word that means we have essentially laid them off. We have laid them off, or they are working because their work is so essential, like an FBI agent, but they're not getting paid. So we're paying them with IOUs. This is not the United States of America. I'm thinking about those people who are working every single day. Let me put a picture on you. So in my own state, we are the headquarters to the National Weather Agency. You know, Madam President, people who watch TV think they get their weather news from either the Weather Channel or they get it from their local local TV or radio station on the weather. Doppler radar. It's terrific. But guess where they get their information? They get it from their federal government. They get it from the weather forecasters at the National Oceans of Atmospherics, who work hard every day predicting the weather and getting out the information in news that you can use in your own community. So if you're a farmer, you're getting that information. If you're a waterman, like on my Chesapeake Bay, and you have to make sure that the storm is not coming while you're out there either crabbing or going for your oysters to keep your own business going, you need your weather. Whether you are a county executive or a mayor, you need to know what that weather is. So, and they've been on the job, whether they've been predicting hurricanes or tornadoes or giving you the basic day-to-day information. The weather forecaster is at their duty station, but what are we saying to them now? Guess what? Be there, but we're not going to pay you except through IOUs. Yesterday I spoke about the National Institutes of Health and the Food and Drug Administration in my own state. There's another major agency, not in my state, but very important to the functioning of our country, the Centers for Disease Control. Right now, they're down there in Georgia, and what is the Center for Disease Control? What is their job? Their job is exactly to do that, disease control. They're the ones when veterans or people were ill and getting sick in a hospital in Philadelphia, they were called in because they are our top bio-sleuths in America. They are our own bioforensics, our own bio-CSI. They were the ones who found out something called Legionnaire's disease. And we helped those people who got sick in that hotel and were able to put out that information. They're the ones that are standing sentry to make sure that there's no emerging or surprise pandemic in the world. They're the ones that are gathering information now to know what are the latest things that could threaten the health and safety of the United States of America. What is it that they're doing? If you're a pediatrician, you're watching the CDC to see what are the latest ear infections that could be affecting children and the right treatment to help them, the right treatment for their doctors to be able to know. That is what it is. When their labs are being closed, it leaves states on their own, state health departments, to be able to look out for antibiotic-resistant viruses, other infectious diseases, a variety of other kinds of things. We need the Center for Disease Control. They employ thousands of people in Atlanta, Georgia. And yet we're telling them, well, maybe not the way we need you. Madam President, yesterday the President passed the bill to guarantee military personnel be paid on time. We support that. But what's missing from the bill is important. The intelligence community, made up mostly of civilians, will not be covered. It means that over 72% who work in our intelligence agencies will either face furloughs or will be working with IOUs. Who else didn't our national security cover? We didn't cover border security. We didn't cover FBI. We didn't cover DEA. We didn't cover the U.S. Marshals. What do the Marshals do? It's not Wyatt Earp. Marshals aren't just out there like cowboys in a Wild West movie where we watch miniseries. The Marshal Service is a very important service. You know what they're doing in Maryland right now? First of all, they provide security in the courthouse. They do the security to protect the judges. We have some of the most violent gangs and criminals coming in. The marshals need to protect those who are enforcing the law through the judicial system. They're also going after the sexual predators. They're the ones who track all of this and go after to make sure that sexual predators aren't loose in the neighborhoods and are working with local law enforcement. And they also go after missing fugitives. You know those big signs that say 10 most wanted? Well, guess who goes after them? The Marshal Services. That's one of their primary responsibilities. Look, that's what federal law enforcement is. Today, these employees are also critical to national security. So trying to do this piecemeal by piecemeal, oh, we've looked out for our troops. You know what? We should look out for our troops. But while we look out for our troops, we should look out for those who come back home. I know that the presiding officer and others have been really strong supporters of our veterans. I'm a strong supporter of our veterans. Many of the services that are being performed by the VA are open, like VA health care. but there are other services where we're going to delay the backlog on veterans' cases, veterans' disability benefits. We in appropriations have actually put money in the federal checkbook to deal with more training, more overtime to reduce this. And when we talk about shutdowns, I want to just take a word to talk about my own office in relationship to veterans. Madam President, I'm the longest-serving woman in Senate history. It's a great honor. And in my 25 years as a United States Senator, and as 25 years as the senior woman here, I've only closed down my office twice. Once in 1995 and this morning. I cannot tell you the heavy heart that I had to talk to my staff. My staff is a great staff, whether they're working in Maryland or whether they're working here in Washington. We are a local phone call to 6 million Marylanders. And of those people who work for me, one is a young lady. I hope I don't embarrass her if she's watching TV. Her name is Denise. Denise has worked for me for 30 years, back when I was in the House of Representatives and now as a United States Senator. She's a caseworker, a constituent service worker, and for 30 years, she has specialized in helping me respond to the needs of veterans. Veterans all over Maryland love her. They depend on her, and I depend on her so that I can help those veterans. I know my time's expired, but Denise's time on the job shouldn't expire. I want to make sure that Denise is on her job. I want to reopen my office. I want to make sure we reopen government. We can do that if we then pass the Senate continuing resolution. Hello to the House. Don't send us piecemeal. Let the House vote on the Senate bill. No gag rule in the House. Free the House. Open up the House. Open up government. And let's get the job done. Yield the floor.
The senator from Utah.
Madam, I'd just like to quickly begin by saying that last night at the stroke of midnight, the federal government experienced its first partial showdown since 1996. Now, there has been a lot of partisan talk back and forth about who is to blame, but our constituents are demanding action and rightfully expect us to resolve this situation. We need to act swiftly to get the government up and running again. Now, Madam President, let me turn to another matter. Today's date is October 1st, 2013. Since the passage of the so-called Affordable Care Act in late 2009, millions of people have looked forward to this day, probably with more dread than anticipation. That's because today is the day that the Obamacare health insurance exchanges, where millions of Americans will be required by law to purchase health insurance, are open for business. Perhaps I should say they are supposed to be open for business. President Obama, in his futile effort to sell his health care law to the American people, has been trying to paint a rosy picture about what will happen starting today. He's claimed that today will mark the first step in a process that will provide health coverage for millions of Americans. Sadly, now that we're here, the picture is much cloudier than the President would like to admit. Indeed, as the exchanges begin to go live, we have more questions than available answers. We know that the exchanges have been met with significant delays for large businesses, delays for small businesses, and even some delays for some of the state exchanges themselves. We know about other technical and logistical problems facing the exchanges. I'll talk more about those in a few minutes. What we don't know is what will happen to the average American trying to sign up and navigate his or her way through the Obamacare exchanges. I'd like to take just a few minutes to talk about that today, Madam President. In doing so, I'd like to talk about someone we met during the 2012 election campaign. Her name is Julia. We all remember Julia. She was the faceless character created by the Obama campaign to symbolize the cradle-to-the-grave support women would receive under President Obama's administration, including under Obamacare. She was supposed to be the embodiment of President Obama's compassion for women and his opponents' lack thereof. Unfortunately, President Obama's, quote, life of Julia, unquote, outline was short on some details, particularly when it came to Julia's efforts to obtain and keep health insurance through the Obamacare exchange. Today I'm going to try to fill in some of those details. However, it will be difficult because, like I said, there is still much we don't know about how the exchanges are going to work. As we follow Julia into the exchanges, the first question that comes to mind is, what brought Julia to the exchange in the first place? Is she one of the millions of Americans who will end up losing the employer-provided health insurance as a result of Obamacare? Is she now a part-time worker after her employer had cut her hours to avoid the employer mandate? Perhaps she was laid off so that her employer could keep their number of employees below the threshold required to be considered small business under the law. In any event, Julia has come to the exchange looking for health insurance because that's what the law requires her to do. The next question is, who will explain to Julia how she can sign up for insurance under the exchange? What we know is that she will be assigned to a navigator, a person employed by a private organization tasked with assisting the uninsured in determining what type of coverage they qualify for. This person, who is not a government employee, will have access to her personal information, including her Social Security number and household income data. Sadly, there's no real telling whether this person will steal that information and use it for nefarious purposes. That's because the administration, in the drafting of the rules for the certification of navigators, cut corners on things like training and background checks, putting consumers and patients at increased risk for fraud and identity theft. I came to the floor to discuss this a couple of weeks ago, Madam President. This was something that members of Congress warned the administration about months ago. Sadly, our warnings have been ignored. So the bottom line for Julia is that before she even enters the exchange, an unqualified navigator, or perhaps an imposter posing as a government counselor, may have easy access to her private personal information, allowing them to steal her identity and create a nightmare for Julia to fix. Somehow, I don't think the authors of Obamacare had this in mind when they created the Navigator program. The next question Julia will face is whether or not the exchange in her state will be ready. This, of course, will depend on where Julia lives. Not all of the state exchanges will be ready to launch today. Idaho, Minnesota, Oregon, Colorado, and the District of Columbia have already announced that they will be delaying the launch of their exchanges. The New York Times ran an article about the delays and glitches facing the exchanges this past weekend. According to the article, quote, many of the 16 directors of state-run exchanges are describing October as a soft launch period, when Americans can start exploring their coverage options, but on websites that may be incomplete, vulnerable to glitches, and perhaps not ready for an onslaught of customers, unquote. In other words, Julia, depending on where she lives, may not even be able to sign up for insurance today because of the problems and delays. Problems and delays that many of the exchanges are now facing. But for the sake of discussion, let us assume that Julia is able to sign on to the exchange and select a health insurance plan. Now that she's picked a plan, the question is, will her personal information be secure? In order to sign up and purchase an insurance plan, Julia will have to hand over a virtual mountain of personal information, including her Social Security number, her tax returns, and the like. All of this data will be entered into the Federal Services Data Hub, a new information sharing network that allows state and federal agencies to verify her information. The problem with the Data Hub is that it has not gone under any independent review to determine if the data that is entered is secure. The administration announced that the data hub had passed internal testing on September 10th, a mere 3 weeks before it was set to go live. Sure, they may claim that the data hub is operational and ready to go, but no independent watchdog, like the Government Accountability Office, for example, has had a chance to verify the security operations or make recommendations to better safeguard the privacy of consumers. Absent an independent review, there is simply no way of knowing whether the exchanges have adequate safeguards in place to protect enrollees' personal information. For Julia, this means that her personal and financial records may be at serious risk of becoming available to data thieves or just plain crooks. Obviously, this is not something the Obama campaign mentioned about Julia when they planned out her life for her. The next question for Julia is whether she will be eligible for premium or cost-sharing subsidies. Depending on her income, Julia may be eligible for a tax credit designed to defray the costs of purchasing health insurance on the exchange. These credits are both advanceable and refundable, meaning that the IRS will pay them first and verify them later. My gosh, what a system. This is what some refer to as pay and chase. The problem with this method of determining the eligibility for subsidies is that there's an increased likelihood that applicants will receive larger subsidies than they actually qualify for. For Julia, that could mean that if she receives a subsidy, she could end up owing the IRS money next tax season. That's not a highly advertised element of the exchanges or the subsidy program, but that's the reality that people like Julia will be facing. Once Julia's plan and potential subsidies are in place, the question then becomes, will she have the same quality of health care that she had before, that she was promised by the President? The Obama administration has made some misleading claims on this front. According to the White House, consumers in states with federal exchanges will have an average of 53 plans to choose from. However, this number doesn't tell the full picture. According to analysis undertaken by my staff on the Senate Finance Committee, 75% of states with federal exchanges will have fewer plans available than the average touted by the White House. In addition, there will be fewer provider networks in the exchanges because in an effort to keep the cost of premiums down, insurers are reducing the number of doctors and hospitals covered by the plans in the exchanges. For example, there is only one insurer in the New Hampshire exchange, and their plan will exclude, now get that word, exclude, 10 of the 26 hospitals in the state. Another example is Blue Cross Blue Shield in California. Their exchange plans will cover only 53% of the doctors and 74% of the hospitals that are included in their broadest non-exchange plans. According to the New York Times, quote, many insurers are significantly limiting the choices of doctors and hospitals available to consumers. From California to Illinois to New Hampshire, and in many states in between, insurers are driving down premiums by restricting the number of providers who will treat patients in their new health plans, unquote. In short, Madam President, this means that on the exchanges, Julia may very well have fewer choices for health care providers, potentially leaving her with limited access to quality care. The final question Julia will face on the exchanges is perhaps the most important, and I call it the final question, but I'm sure there are others. Will Julia have to pay more for her health insurance under the exchanges than she did before this wonderful, quote, Affordable Care Act, unquote? This, once again, depends on the specifics of Julia's situation. If, like most Americans, Julia previously had employer-provided health insurance, she'll likely be paying more for her insurance in the exchange than she did through her employer. While some enrollees may be able to find cheaper insurance through the exchanges, the majority of Americans will pay more for health insurance under exchange than they do now. The Manhattan Institute found that individual market premiums will increase 99% for men and 62% for women nationwide with the exchanges in place. The bottom line for Julia is that, depending on her plan, she may very well end up paying more out of pocket for her health care than she did before Obamacare was in place. As you can see, Madam President, the reality of Julia's experience on the health insurance exchanges doesn't really resemble the pretty picture President Obama painted for her during the campaign. She will almost certainly face a number of difficulties just navigating the process. I don't blame President Obama. He was just told what to say by so-called experts on health care. But those experts have been wrong, wrong, wrong too many times. In the end, it'll likely end up costing Julia more to buy insurance on her exchange. Of course, Julia is not a real person. Her problems are imaginary. However, the problems that real Americans, including people from my state of Utah, will be facing as the exchanges open today are very real, as I've described them. Put simply, these exchanges are going to live today with too many unanswered questions and too many unsolved problems. We should have never gotten to this point, Madam President. The Obama administration should have acknowledged the ample warning signs of problems in the exchanges and heeded the many calls for delay. The administration was all too willing to delay the pain businesses will suffer under Obamacare. Sadly, the American people got no such special treatment. All I can say, Madam President, is that those of us in Congress will be watching these exchanges closely. The American people will be watching them too, and they'll be experiencing them, which may not be very pleasant in light of the promises that were made to them. If what we've discussed or witnessed so far is any indication, I don't think we or they or Julia will like what we see. Madam President, I suggest the absence of the quorum.
The clerk will call the roll. Mr. Alexander. senator from California.
Thank you very much, Madam President. I come to the floor as the chairman.
The Senate is in a quorum call.
I ask that the quorum call be vitiated.
Without objection.
Thanks, Madam President. I come to the floor this morning as the chairman of the Intelligence Committee in order to speak about the effect that the government shutdown is having on the community and what effect it will have if it continues. Let me give you the most important figure up front. Across the intelligence communities, 72% of the civilian workforce is being furloughed. That means that with the exception of a few intelligence agencies that have a significant number of military personnel, the lights are being turned off, and the majority of the people who produce our intelligence, analyze that intelligence, and provide warning of terrorist attacks or advise policymakers of major national security events will be prevented from doing their jobs. This is simply stated unacceptable. The failure of this Congress to perform its most basic functions means that our country is at heightened risk of terrorist attack. Intelligence provides this nation with its first line of defense, because long before a threat makes it to our shores, the men and women in our intelligence community learn about it, sound the warnings, and often take the steps to neutralize that threat. Before the President or the Secretary of State make decisions on UN Security Council resolutions, such as a resolution to end Syria's chemical weapons program, they review the intelligence and they seek the advice of intelligence analysts. Finding Osama bin Laden in a house in Abbottabad and removing a bomb from an al-Qaeda operative in Yemen aren't things that just happen. They require the dedicated work of a huge array of professionals. Good intelligence requires the following: CIA officers on the ground around the world meeting with sources, technical wizards who collect signals and imagery information, engineers who put together the systems to bring the information back to Washington and who convert the ones and zeros of computer code into meaningful, actionable intelligence. Today, 72% of the civilian workforce will not be doing this job. Our shutdown is the biggest gift we could possibly give our enemies. I understand and I support continuing to pay our military men and women operating both at home and abroad, including tens of thousands still deployed to Afghanistan. By furloughing our intelligence workforce, we put our uniformed men and women at risk, as they too rely on the intelligence agencies to tell them where the next assault may take place or the next IED is hidden. We have ambassadors in threatened capitals. I can guarantee that our ambassadors in Kabul and Baghdad, Sana'a and Islamabad rely on their intelligence briefers and the tactical intelligence support to their security teams as much as they rely on the Marines who guard the front gates. I met earlier this spring with Ambassador Ann Patterson in Cairo. I saw the gates and walls of our modern embassy that had been overrun by the same crowds protesting down the street in Tahrir Square. And I met with the CIA and NSA and other intelligence officers who give the ambassador and her team warning when the extremists are looking to try to attack our embassy again. Some of these intelligence professionals will obviously remain on duty and are absolutely essential. But by furloughing the majority of the intelligence civilian workforce that they rely on, we're preventing them from effectively doing their job. I spoke yesterday with Director James Clapper, the Director of National Intelligence. At my request, he sent me a short report on how the shutdown will affect the largest intelligence agencies. In addition to the 72% overall figure, His report lists how the shutdown will cripple the CIA, the NSA, the Defense Intelligence Agency, the National Geospatial Intelligence Agency, the National Reconnaissance Office, and the Office of Director of National Intelligence, to include the National Counterterrorism Center. Every single agency I just listed will lose the majority of its civilian workforce. Many of them don't have a sizable military component that is exempt from the shutdown. Now, these numbers are still classified, but any senator who wants to see how our failure to fund the government is harming the intelligence community is welcome to come and find out and read this report. It's in the intelligence office on the second floor of Hart. The intelligence agencies at the Department of State, Treasury, Energy, and Homeland Security are hit even worse. Madam President, I wholly regret that we are in this situation. I regret that across the country, national parks are closed, federal safety inspectors are sidelined. For 4 years, we have squeezed the discretionary appropriation levels to the point that every part of the federal government has had to cut back and make do with less. But what we are doing now puts American lives at risk. It's an abdication of congressional responsibility, and I wanted to come to this floor to make clear to every member of this body that what we have done directly damages our national security. I would also, if I may, seeing no one else on the floor at the moment, like to take the opportunity to speak of some of the cutbacks that are in process in the area of energy and water. Since 2001, I have served as chairman of 3 different appropriation subcommittees: Military Construction and Veterans Affairs, the Interior Department, and today the Subcommittee on Energy and Water Development. And over the years, I helped make a lot of tough choices on what programs to fund and what not to fund, and et cetera. But never have things been as bad as they are today. The cuts we are making to our appropriation bills under sequestration are strangling programs that must be funded. Programs that are vital to our country, vital to public safety, and programs that promise to deliver the next breakthroughs in energy research. Let me talk about some of the negative effects a shutdown and continued sequester. Agency within my subcommittees that may have the most direct impact on the public is the Army Corps of Engineers. The Corps safeguards our dams, our levees, our drinking water. It keeps our harbors open for cargo ships, and it maintains more than 4,000 recreation sites. Most people don't know that. Simply put, Madam President, a government shutdown is meaning the termination of a wide range of Army Corps of Engineers activities. Let me mention flood control for a moment. Work is stopping on virtually all construction projects, studies, and activities related to flood control and navigation across this country. These projects protect tens of millions of Americans. A shutdown is meaning that the Corps stops work on improving dam safety projects, including the dam at California's Isabella Lake, the dam most at risk of failure in our state. Halting these projects endanger citizens and ultimately increase the cost to complete this work. What's more, these projects actually reduce overall costs to the federal government. Damage prevented by Corps projects, this is just damage prevented, exceeds $25 billion a year. It is indeed a big deal. Levees. Other Corps projects are being interrupted by this shutdown include the strengthening of levees and flood walls to reduce the risk of loss of life and economic loss from flooding and coastal storms. Work is stopping on improvements to flood protection levees along the Mississippi River, levees that experienced record flood levels in 2011. Projects in Boston, Kansas City, and Seattle would be suspended. Even worse, these construction delays would come at a time when severe storms are causing damage with greater frequency.
Time has expired.
I believe, is the senator next on waiting to speak? If I may just be afforded a couple of seconds.
Without objection.
And I'll put the rest of my remarks in the record. I just wanted to say a couple of things about the much beleaguered health care plan. I just want to say what is happening so far. During the first 3 hours today, the federal health care website, healthcare.gov, with information about exchanges across the country, logged 1 million visitors. As of 9:30 this morning in Kentucky, Health Exchange had 24,000 visitors and processed more than 1,000 applications. I'm anxious to provide the West Coast numbers, but the 3-hour time delay. There were 2 million visits to New York's Health Exchange during the first 2 hours of the launch site. Even at 11:30, Connecticut had 10,000 visitors and 22 people enrolled. Let me just end with this one story. Paula Thornhill, a mother of 7 who lives in Virginia, was the first to apply for coverage today in her county, which is Prince William. She is quoted as saying, "I'm relieved that they did come out with this affordable health care," she said. "I am relieved." So far so good today, and I am just hopeful that this tyranny of the minority, will end shortly. Thank you, and I thank the senator from Louisiana. I yield the floor.
Mr. President.
Senator from Louisiana.
Thank you, Mr. President. Mr. President, I come back to the Senate to urge the following. I hope as we try to resolve this important spending bill that a key part of that resolution is to live by existing law under Obamacare and make sure that members of Congress and our staff aren't treated far differently and far better than the American people. Mr. President, that's what the congressional portion of my No Washington exemption bill and amendment is all about. It's a pure and simple principle. I think it's the first principle of democracy, and American democracy should work by that first principle. What is good for America is good for Washington, and what Washington imposes on America, it must live with itself. No special exemptions, privileges, subsidies, or rules. The same rules. I think that should be the rule across the board. Whatever part of law we're talking about, it should certainly be the rule under Obamacare. And indeed, Mr. President, it is the rule under Obamacare, under the statute. What I've been fighting is an illegal regulation promulgated by the Obama administration to get around the clear language and the clear intent of the statute. Mr. President, as you know, during the Obamacare debate, this issue came up and was debated, and language was passed here in the Senate, was put into the statute. And that language says, pure and simple, every member of Congress and all official congressional staff have to go to the so-called Obamacare exchanges for their health care, same as other Americans who are going to the exchange. No special treatment, no special exemption or rules or subsidies. That's the clear language, and that was the clear intent. Amazingly, I was happy to see at the time that language, which I fought hard for with many, many others, led in the Senate side by Senator Chuck Grassley, that was adopted. That became part of the statute that passed into law. Well, apparently, it was an example of that old Nancy Pelosi quote, "We have to pass the law to figure out what's in it." because that language did pass as part of the Obamacare statute. And then lots of folks on Capitol Hill started reading the details, and when they got to that section, they said, oh, you know what, we can't live with this, we can't have this, this is a crisis. This would actually apply the exchanges to members of Congress and our staff just as they're applied to millions and millions of other Americans, 8 million plus, who are losing their previous employer-provided health care against their will and being forced to go to the exchange. And so when that happened after the passage of Obamacare, furious scheming and lobbying started going on behind the scenes. And this included lobbying of the administration. Harry Reid, many others getting involved, asking the President to get personally involved to bail Congress out to prevent this clear statutory language from having its clear force and effect. And sure enough, that worked. President Obama, according to numerous press reports, got personally involved. He literally picked up the phone, had conversations personally with folks in his administration about this rulemaking, pretty unprecedented, and sure enough, a rule was issued conveniently right after Congress left town at the beginning of the August recess to flee the scene of the crime. And that rule, the so-called OPM rule, completely illegal in my opinion because it's contrary to the statute, does two things. First of all, the rule says, well, yes, the statute says all members of Congress and all official congressional staff go to the Obamacare exchanges for health care, but we don't know who official staff is. We have no idea. We can't figure that out. So we're going to leave it up to each individual member of Congress to figure out who of their employees is official staff for purposes of this section, and we're never going to second-guess any decision by any member of Congress, even though this could result in up to 535 different applications of the law. Well, Mr. President, I think we should all be able to agree that is flat-out ridiculous. The law is written, it's written clearly, it uses words, official congressional staff, and for OPM to say through this rule, oh, we can't figure that out, we'll leave it up to each individual member of Congress, is ridiculous, particularly since that would allow a member saying, no one who works for me is, quote, official staff for purposes of this section. What? So they can completely get around the law with regard to staff that way? That is just flat out ridiculous. And the second thing this illegal OPM rule does is says, well, even for members of Congress and that staff that do go to the exchange for their health care, they get to take with them something that no other American from a big employer in that sort of situation gets to take. They get to take with them their previous Federal Employee Health Benefit Plan subsidy, a huge taxpayer-funded subsidy that no other American at that income level would get. Completely separate treatment, not envisioned by the statute in any way, not mentioned in the statute in any way, plenty parts of the statute contrary to that. They get to take that with them to the exchange. Is that available to any other American in that situation at that income level? Absolutely not. Well, again, Mr. President, flat out ridiculous, flat out at odds with the clear statutory language and intent of that provision of Obamacare. And so ever since we came back into session after the August recess and had the opportunity to correct this egregious, illegal OPM rule, I've been fighting with others to do that. I've been fighting with a number of Senate colleagues, and I thank them all for their active involvement. I've been fighting with Congressman Ron DeSantis of Florida, who's been leading the House effort, and many, many House colleagues who are all for this measure. And again, Mr. President, I want to make clear and underscore, because it's important, with regard to Congress, members of Congress and staff, this isn't demanding some new law. This isn't demanding some change to Obamacare. This is saying let's simply live by what the law is. Let's simply live by the clear statutory language. That's what we need to do. And we need to do it because it's fair and right by the American people. We need to do it because Americans are sick and tired, quite frankly, of Washington elites treating themselves like a higher select ruling class. You know, that's exactly the concept that the American Revolution was founded on. That's exactly the mindset that led to our breaking away from Britain, which was a monarchy, which was governed by that mindset. And yet here we are, as in many other cases, Washington is reintroducing that principle. That is a thoroughly un-American principle. And the first principle of American democracy is, and we should affirm it, that what Washington passes on America, it lives with itself, same rules, no special exemptions, carve-outs, subsidies, bailouts. What is good for America is good for Washington, and it should be applied equally across the board. Simple concept, Mr. President, basic concept, Mr. President. As I said, I would call it the first rule of American democracy, but it's being trampled on in this instance. It's being trampled on as yet again Washington itself up apart above the American people as a select elite ruling class. That's wrong, Mr. President, and it's wrong as yet another of a number of exemptions from Obamacare. It's wrong as yet another example of special treatment, carve-outs, waivers, exemptions. The President often says this is the law of the land. He's right. And so why don't we apply the law of the land as it's written across the board, no exemptions, no waivers, no illegal rules that are contrary to the clear language and intent of Obamacare. And why don't we start by applying Obamacare just as it's being applied in America to Washington? Why don't we start by living by the letter and spirit of the law, saying all members of Congress, all congressional staff, go to the exchanges for their health care and don't take any special taxpayer-funded subsidy with them that's unavailable to any other Americans at that income level. That's leadership, and that's what we need to do. That's not changing the law. That's living by the law. We need to do that, and we need to do it now as part of any resolution to these spending bill disagreements. Mr. President, I urge my colleagues to gather around this principle. I urge my colleagues to vote right on this issue. And I assure my colleagues they're going to get the chance to vote one way or the other. I'm going to continue to demand a clear, clean, up or down vote on the Senate floor on this issue. We have not had it. I've fought for it for going on 4 weeks, but because of the extraordinary efforts, quite frankly, including threats and intimidation and bribery, extraordinary efforts by the majority leader, we have not been allowed that clear up or down vote. Well, I'll assure my colleagues we're going to get it. I don't know when, I don't know how, because I don't control that. But I'm going to make darn sure we're going to get it. And not much, if anything, substantive is going to happen until we do. This is overdue because this goes into effect today.